Hi, my name is Kevin Noel. I'm going to be doing the intradermal injection video first. So I'll just go ahead and dive in. I'm pretty sure that we're supposed to use this box that has the skin example on it, and I'm pretty sure that this thicker one here is going to be for vein work because there is a tube. So I'm going to go ahead and use this flat one. But in my practice, it was a little weird. So anyways, I'm assuming that's what we're supposed to use, so I'm going to go ahead and use that for the video. So to get started, we would gather all the correct materials, which I believe I've already done. So we're going to go ahead and use the tuberculin safety syringe with the needle. It's a 5/8 needle, which would be used for an intradermal injection with a 25 gauge. It's a 5/8 25 gauge, and the 25 to 27 is what's used for intradermal. So that's what we're going to go ahead and use in this case. I've already opened it because I was practicing with it, but I'll show it in just a second when I draw up everything and stuff. So we'll also have alcohol prep pads, which we're going to use to wipe down, one for the vial, and then we're going to need one for the patient's arm as well. Two for the patient's arm, actually, because we're going to have to wipe it after. So I'll go ahead and get that out now. The other one. And then we're going to verify the 6 rights of administration. I'm sorry, I also have clean gloves as well. And my vial of liquid. I assume that we're supposed to use this one because this is the only vial that I had that wasn't insulin or mock insulin. So I'm going to go ahead and use this for my my actual liquid since the needle wasn't pre-filled. Go ahead and verify the 6 rights of medication administration. So I want to make sure we have the right patient. So when we're getting everything ready, we do want to make sure that we're double checking the order with the EHR, with the electronic health record. We're going to want to make sure that we are verifying all the correct drug. So we want to make sure that we're pulling out the correct drug, the correct dose. So we want to make sure that we have the right dose. And in this case, we're going to be working with tuberculin. We're going to be administering 0.1 milliliters intradermal with the tuberculosis skin test with the little wheel or the bleb. So we'll verify that we have the right dose, which is 0.1 milliliters, the right route, which is intradermal, and the right documentation. So we want to make sure that we are documenting everything as we do it to make sure that nobody's doubling up on any of the work or giving the patient any extra medication or anything like that. In this case, we do want to calculate the right drug dose and everything. In this case, it's 0.1 milliliters. The syringe that we're using isn't milliliters, so we don't need to do any calculations. It's going to be drawing 0.1 milliliters from the vial into the syringe. So getting started, the first thing I would do is introduce myself to the patient. So my name is Kevin. I'm going to be your nurse today. We're going to, and then I would go ahead and, provide patient privacy. So, hi, my name's Kevin. I'm going to be your nurse today. And then we go ahead and close any curtains that we have. We'd want to make sure that we have the right patient. So using 2 patient identifiers, we want to, which, as said in the previous videos, can be, typically name and date of birth is what you want to verify. So their patient should have a wristband on that has their name and their date of birth or a barcode. Barcodes are really easy to do because you can scan it and then verify the information. But we'd want to go ahead and verify that with the electronic health record and make sure that we have the right patient, we're in the right room and everything, and administering the right medication. The next thing we would want to do is to ask the patient if they have any allergies. So food, seasonal medication allergies, anything like that, especially medication in this case because we are going to be administering one. We're going to want to talk about the medication. So tuberculin it's a TB test. So what we're going to be doing is we're going to be doing a really small injection right underneath the surface of the skin, and it's going to create a little bubble, and that bubble should go away. So what we're going to do is we're going to do that, and then about 2 to 3 days we're going to have the patient come back. We're going to take a look at it, and if it's gone away, that's good. If not, then we have to measure it and take a look at it and make sure that everything looks okay. If it's hard or anything like that, measure the area of redness and stuff. So some common side effects of tuberculin are, I was studying this prior to, there can be problems with the injection site, so there can be redness, pain, a rash, discomfort, stuff like that. It could cause shortness of breath, lightheadedness. Sometimes it can cause an allergic reaction and stuff like that. So if anything is happening like that, we're going to want to have the patient definitely talk to us and let us know that those things are happening. We're going to keep an eye on a patient for a certain amount of time after, just to make sure that that's okay. There is going to be a slight burning sensation when we administer the medication. That's normal. So if there are any of the adverse effects or any of the side effects that I just listed, if any of those happen, we want the patient to let me know immediately. That way we can try and reduce the amount of discomfort and irritation and potential problems that could be caused. At this point, I'd ask the patient if they want to ask any questions, if there's anything that they have, any questions that they have about this at all. In this case, we're going to go ahead and assume that they said no. After this, we're going to want to go ahead and perform hand hygiene. So I would be washing my hands. Again, for proper hand washing, we want to have the hands pointed down toward the bottom of the sink. That way the water runs right down. Wash our hands for at least about 30 seconds. Make sure that we're getting in between our fingers and underneath our nails and everything like that. We want to use warm water. Not hot, not cold, but right in the middle. And once we're done washing our hands, if we're using a foot pedal, we can just make sure we dry our hands off with some towels. If not, then we're going to want to go ahead and use the towels to turn off the water faucet as well. That way we're not touching that after, because we touched that with our dirty hands. After that, we'd want to go ahead and apply some clean gloves. So applying clean gloves, it's pretty straightforward. Go ahead and put these on. Grabbing by the inside of the glove and putting them on like so. All right. Next, we're going to want to select the right equipment. So as I already stated, for an intradermal injection, we're going to go ahead and use a 5/8 needle with a 25 gauge. 25 to 27 is pretty typical. 5/8 needle is pretty typical for intradermal as well. So we're going to want to go ahead and get that. We're going to want to next prepare the medicine vial. So in order to get the medicine vial ready, we're going to want to take the cap off, which I already did because I was practicing. And then we're going to want to wipe the rubber top clean with an alcohol swab. So my vial here, we're going to want to go ahead and wipe this down. And that just keeps it clean. That makes sure that, the needle isn't going to be touching anything dirty or anything like that, which is really important because we don't want, the patient to have anything injected that would harm them. So we're going to go ahead and dispose of the alcohol swab. Next, we're going to, so whenever you fill a medication in a vial, you want to displace the amount of medicine that you're taking with air. So in this case, we'd have 0.1. So on my syringe here, I would want to go ahead and pre-draw up 0.1 milliliters. And see, we've been making sure, so at the bottom here, it does say milliliters. I'm not sure how well you can see it, but we'd want to go ahead and draw up 0.1. Trying to find an area where you can see 0.1. And we draw up that much air. I do have the safety up right now, and that's just to make sure that A, I can see, and B, that I'm not getting a needle stick going. All right, so next, I've drawn that up, and then I would go ahead and pull the medication in the syringe. So I'd go ahead and pull this down. I'm going to take my vial. I'm going to insert the needle in. I'm going to go ahead and push that air in. And then I'm going to go ahead and draw the medication in. So I want to draw 0.1 milliliters in here. All right. And just to show you again, I've got 0.1. I'm trying to find the numbers on there. I don't know if you can see them because of the black label, but there's 0.1 milliliters in there. We want to make sure that we remove any air bubbles from the syringe there, just by giving it a little push. Okay, good. Good to go. And next, so we want to verbalize the correct dose and everything. So when we're talking to the patient, we definitely want to let them know, not talking to the patient, but when we're looking at our medication before we administer it, we do, again, want to triple check and just make sure that we have the right medication, the right dose, the right patient, everything like that. We still are constantly trying to be vigilant about making sure that we are administering the correct medication. So again, we have here we have 0.1 or 0.1 milliliters of medication. That's what we've got drawn up here in this vial. The next so with an intradermal injection, we're going to want to go onto we're going to go onto the forearm, but we're going to go about 3 to 4 fingers below the antecubital space. I think that's how it's pronounced, which is basically one hand above the wrist. So, we've got our injection site here. I'll point this down so you can kind of see. All right. All right. So normally we'd be going here, and we would want to go through. So we basically would be going right about from my wrist. We'd want to go pretty much right about here, and that's where we would want to be injecting. We would also, so before we do any injection, we want to go ahead and note any lesions, skin discoloration, and we'd want to check and make sure that there wasn't any tenderness. If there is any of those things in the patient in the injection site, we would want to go ahead and select another site, so maybe a different arm or something like that. So once we're done with that, we would want to go ahead and clean the site with an alcohol swab, assuming that this is our site here. We want to go ahead and wipe that off. So when you're cleaning with a swab, you want to start at the center of the site, and then you want to do outward in a circular motion about 2 inches. And that is going to clean the site. After we clean it, we want to let it dry on its own. We do not want to blow on it or use our hands or anything like that to clean it. We don't want to touch it. Touching it would essentially just completely negate the fact that we just clean it, and we would have to redo it if we did that. So next we want to take our syringe. We want to hold it between our thumb and our forefinger of our dominant hand, which to me is my right hand. And we want the bevel of the needle pointing up. The bevel is on the needle. It is the slant. So we want to make sure that we have that. All right, we've got it up. All right, so with the non-dominant hand, what we're going to do is we're going to go ahead and stretch out the skin. By stretching out the skin, you're just making sure that you are going to be able to get a good clean injection. It's not going to bunch up. It's not going to hurt the patient or anything either. So with the needle needs to be almost against the patient's skin. You basically want to hold it at I do a 10-degree angle for intradermal because it's supposed to be between 5 and 15, I believe. So keeping it at 10 is perfect. So we'd want to keep it with the bevel pointing up, about a 10-degree angle like so. It would be easier if I do. Yeah, you can get a better view from there. So same injection site. Keep it like this. And then we would want to put the needle in about 3 millimeters in, which is about, I believe, 1/8 of an inch into the skin surface. So as you're going in, you want to go nice and slow, and you're going to see the needle bulge underneath the skin. Okay. After that, so we're going to go ahead and we're going to administer the medication after that. So again, it's right there, 3 millimeters underneath the skin. We're going to inject it nice and slow. And what that's going to do is it's actually going to create, we want to make sure that there's some resistance there. Make sure that there's some resistance. Perfect. All right, and then slowly pull it out. And this thing's a little weird, but so we want to feel some resistance. The reason we want to feel some resistance is because if we don't, then we're too deep, and we'd have to remove and begin the injection again. As injected as there is right now, there's a little bleb here, a little wheal, which is just basically the medication sitting in the intradermal spot. So it's going to look like a mosquito bite is a really good way to put it. So we withdraw the needle, and then we go ahead and cap it. We don't want to put the original cap on, which is right here. We don't want to do that. We want to go ahead and just use the safety feature there. Once we do that, so once we remove the needle, we want to go ahead and place an alcohol swab or a gauze directly over the site. And we just kind of want to pat really gently. We don't want to massage the site. We cannot massage the site. So just kind of wipe it off and make sure that it's clean. And then we would put a Band-Aid over it if needed, but I've never had a Band-Aid for me, so I'm not going to put one on. Again, we don't want to recap the used needle with this cap. We want to go ahead and just recap it with the safety feature that we have here, and then we're going to go ahead and dispose of this in the sharps